All right, hey guys, this is Mike, and I'm here with Tom, and we are back for the new year with a billing and coding pearl. And today we wanted to talk about Medicare attending notes, and this came up in our Med Systems meeting that we just had earlier today, so this is hot off the presses.
It is absolutely hot off the presses. So just as a recap, I think most of you guys know that when we take care of patients that are covered by any federal insurance company, any federal insurance plan, that's Medicare, state Medicaid, TRICARE, active duty military. So those groups of people are covered by a more strict group of rules than our private payers and obviously than our self-pay patients. So Medicare and the federal government has a thought that they already pay for resident education through payments to the medical schools and to the training programs. And so if a patient is seen only by a physician in training that's a resident, they don't want to pay for it because they feel like they've already paid for it. So
understandable.
They only want to pay for patients that are seen by attending physicians. And so if a resident sees a Medicare patient, we have to have a Medicare attending note that documents the attending physician's involvement in their care. So they won't pay unless you've got a supervising note. We've got a supervisory note template that is already built into our system. And further than that, okay, you got your residents, and you have your PAs, and so the federal government also says if a PA sees a patient, that's fine, we'll pay. We're only going to pay 85% of what we would pay for a physician.
It's like they have a coupon. Exactly.
It's 15% off. It's unbelievable. So who's got Medicare? Deal. Military, their families, anybody over 65, anybody that's on disability. So a lot of our chronic psych patients. Some of our patients that have fibromyalgia that are on disability. And, you know, we already talked about
no judgments here. No judgments.
And then dialysis patients. So anybody that's on dialysis, they automatically have Medicare.
Right. The best way to identify this is just look at the face sheet when you're getting a presentation on a patient that you've seen.
But there are situations where you want to pay attention. So if you see a dialysis patient, you know they're going to be Medicare. So what the note has to say is that you were present, that you participated in the key portion of the visit. So we've all seen the template. The template works pretty well.
Right. Doc X super.
You know, so if someone came in with a cough, the key portion might be listening to their chest and looking at the chest X-ray.
Right.
Somebody comes in with a cut, it may be walking in and supervising the key portion of the procedure that's done. So the resident sewing up the laceration, and it's a lip laceration, you may want to walk in and be there to make sure the vermilion border is approximated. If there's a procedure done, like a ultrasound or a central line, the key portion of that procedure, and of course with an ultrasound, the key portion is going to be
the ultrasound
and capturing those images. So those are the things that have to be documented on the Medicare attending note.
Right. And the ultrasound portion of that is very important. We've had several cases recently where we've identified that a attending supervised, or maybe the resident did the ultrasound and then sort of talked to the attending about it afterwards, but you know, the attending wasn't as involved in that as maybe what we would have liked it to be. So we need to be very careful when we're writing these notes that we actually did what we're saying we did.
Right, and actually our next billing and coding pearl is going to be about ultrasound notes.
It is.
It is.
I can hardly wait.
So stay tuned. That's pretty much
it. That's it. Okay, as always, if you guys have questions, comments, concerns, please let us know. If you have topics that you'd like to hear us covered, please shoot us an email. We hope you like the new format with the video. We've added video enhancement to it.
Right. We've had some things. Oh, one more thing. Can I say one more thing about Medicare?
Absolutely. Yeah, absolutely.
So if you see a patient with a resident and they have Medicare, and you get a query from the coder, did you supervise this patient? We need a Medicare attending note. If you didn't physically see that patient, please do not write a Medicare attending note.
Yes. Important safety tip,
that
folks.
Would be considered fraud. So you have to physically be present. If you didn't, just tell the coder, I don't remember the patient. I don't remember actually seeing the patient.
Right.
We won't bill the patient. I would rather give up that bill than have a incorrect attestation that you were at the bedside and that you supervised the
Absolutely.
patient. So just that's the last thing.
All right, and that's everything, folks.
All right, sayonara.
Till next time.